My name is Alberto Tripodi. I am a cardiac surgeon from the Department of Cardiovascular Surgery of Maria Cecilia Hospital in Ravenna, Italy. For sure, the worse quality and increasing age of patients who are requiring a cardiac operation have led us in the past few years to a continuous research in terms of surgical techniques, in terms of new products and new devices which consent a reduction of trauma after surgical procedure. In these terms, for sure, a lot of new devices for extracorporeal circulation, mini extracorporeal circulation has been realized. We want to present the Evado system, that is a new concept of extracorporeal circulation that is very useful because we can apply it to all kinds of cardiac operation. It's very user-friendly and safe and can be applied to all kinds of cardiac procedure. The concept of the Evado is mainly based on three new concepts. The first is a strong reduction of priming volume, which is obtained by reduced tube length and reduce of the diameter of the tubes, and we can arrive priming of 500 milliliters. So we can have really a good hematocrit value and a good hemoglobin value during extracorporeal circulation. The Evado system is very useful because it consents a better hematocrit and hemoglobin levels during and after extracorporeal circulation and a better oxygen delivery during the procedure.
To carry out the Evado procedure, we need an Admiral oxygenator, vacuum regulators, and the Evado kit EU4655. The Admiral oxygenator consists of a cardiotomy reservoir, a venous reservoir, and an oxygenator module. The characteristics of the oxygenator module are priming volume 190 milliliters, contact surface area 1.35 square meters, maximum blood flow rate 7.0 liters per minute, heat exchanger surface area 0.08 square meters, heat exchanger performance factor 0.64 at 4 liters per minute, coating phosphorylcholine. 2 vacuum regulators are needed. A vacuum regulator for extracavitary aspiration, which has maximum 160 millimeters of mercury and is connected to the vacuum pump, and a vacuum regulator for intracavitary aspiration and vacuum-assisted venous drainage, which has maximum 100 millimeters of mercury and is connected to the vacuum wall. You then need a dedicated Evado kit EU4655. While setting up the procedure, you can use your tubing set, preferably with 3/8 of an inch venous line. In your tubing set, you should find 2 suckers, an extracavitary sucker, which is generally marked by a yellow line, and an intracavitary sucker, vent, which is generally marked by a green line. Both suckers include a pump segment. Take the extracavitary line. Cut the extracavitary line before the pump segment. Then connect the extracavitary line to the cardiotomy. The pump segment is no longer used. Take the intercavitary line. Cut the intercavitary line before the pump segment. Connect the intercavitary line to the dedicated port of the venous reservoir. The pump segment is no longer used. To carry out the Evado procedure, you just need the Evado set EU4655. Connect the green line to the green vacuum regulator. This green line is a pneumatic line used to create vacuum in the reservoir. Then connect the green line to the vacuum port. Subsequently, connect the yellow line. This yellow line is a pneumatic line to create vacuum in the cardiotomy. Connect the yellow line to the vacuum port in the cardiotomy. Then connect the two safety valves. Connect the transfer line. This line allows to transfer blood from the cardiotomy to the reservoir. Close the clamp. Take the depriming bag, also known as the retrograde autologous priming bag, and then connect it to the arterial venous shunt if present in your tubing set. The vacuum regulator for extracavitary aspiration, which has maximum 160 mm of mercury, is connected to the vacuum pump. The vacuum regulator for intracavitary aspiration and vacuum-assisted venous drainage, which has maximum 100 mm of mercury, is connected to the vacuum wall. We will now observe the Evado extracorporeal circulation vacuum-assisted drainage optimized system during the procedure. At the beginning of the surgery, only the extracavitary sucker is working. Blood coming from the extracavitary cavity reaches the cardiotomy. The master pump is not yet in function, and obviously the venous reservoir is empty. The venous line is still clamped. We now remove the clamp from the venous line, and the master pump starts working. As you see, only the master pump is working. The remaining pumps are switched off. Now we start to deliver the cardioplegia solution. If necessary to increase or decrease the vacuum applied to intercavitary and extracavitary suckers, simply regulate the two vacuum levels by turning the knobs. The green regulator is used to regulate both the intracavitary sucker and the venous return, that is to say, the vacuum-assisted venous drainage. Blood collected in the cardiotomy coming from the extracavitary cavity needs to be transferred to the reservoir. Release the vacuum in the cardiotomy simply by opening the clamp on the yellow pneumatic line, while simultaneously opening the clamp along the transfer line. Now, the bypass is completed. To sum up, the features of the Evado are: Pumpless intercavitary and extracavitary suckers, which means lower trauma on red blood cells and lower free plasma hemoglobin. A paediatric set with 3/8 of an inch venous line. Lower priming, almost 500 millilitres, with a hematocrit increase during extracorporeal circulation and an increase in oxygen delivery. The Evado system can be used for any surgical techniques. Thanks to the Evado technique and its features, the patient has less post-operative bleeding, requires less transfusion, and needs less time in the intensive care unit. Our goal is to ensure better patient outcomes.